Hello, my name is Alex Holbrook. This is my community health education project for community health nursing at the Indiana State University LPN to BSN program. Cardiovascular disease, risk and prevention for Black Americans. These are the following learning objectives for this presentation. Number 1. Define cardiovascular health, heart attack, and stroke. 2. Identify risk factors associated with cardiovascular disease amongst Black Americans. 3. Describe potential health risks and conditions associated with cardiovascular disease. 4. Describe strategies to improve cardiovascular health of Black Americans. 5. Describe community-based education that promotes cardiovascular health. Before we begin the presentation, please click the link below and complete the pre-test. After you have completed the test, please resume the presentation. There will be another test following the presentation. What is cardiovascular disease? Cardiovascular disease constitutes disorders of the heart and/or blood vessels, and is the leading cause of death in the United States, according to the CDC. Coronary artery disease, which is a disorder of major vessels in the body. Coronary artery disease can lead to myocardial infarction, also known as a heart attack. Coronary artery disease is responsible for the deaths of over 360,000 Americans in 2019. And the trends continue to rise. Cerebral vascular disease, disorders of decreased blood flow to the brain, including strokes. A heart attack or a myocardial infarction refers to the interruption of blood flow to the heart. A heart attack can result in permanent damage to the heart or even cardiac arrest or death. Over 800,000 Americans experience a heart attack at least every year. A stroke refers to the interruption of blood flow to the brain. A stroke can result in permanent damage to the brain, loss of motor or cognitive function, or even death. Every year, almost 800,000 Americans experience a stroke. Strokes are the leading cause of long-term disability in the United States. Strokes are also responsible for 1 out of every 6 cardiovascular-related deaths in the United States. The following are risk factors that are associated with cardiovascular disease: high blood pressure or hypertension, high cholesterol, specifically LDL cholesterol or low density lipoprotein, obesity, sedentary lifestyle, poor diet, and tobacco use. For African Americans, despite only making up 12% of the population in the United States, almost a quarter of all deaths related to cardiovascular disease were of Blacks and African Americans, according to the CDC. From 2013 to 2016, almost 60% of Black adults had some form of cardiovascular disease. Multiple risk factors increase the chance of cardiovascular disease and death. Knowing this information, this places African Americans at a greater risk for death or injury related to cardiovascular disease. With this increased risk, we must concentrate on preventing the risks, specifically for African Americans. Almost 58% of Black Americans have elevated blood pressure, according to the CDC in this year. Elevated blood pressure greatly increases the chance of heart attack or stroke in patients. In addition, 24% of Black Americans have been found to have high cholesterol. The increased levels of cholesterol in the blood make it a greater chance for them to suffer a heart attack or possible stroke. Obesity has also been found to have a factor in cardiovascular disease. And according to the CDC, Black Americans have the highest prevalence of obesity at almost 50% in the United States. Another preventable risk is tobacco use. Tobacco use can increase the blood pressure and damage the blood vessels, which also increases the chance of cardiovascular disease. Almost 20% of Black Americans smoke some form of tobacco. This includes cigarettes, cigars, cigarillos, or vaping devices. In order to promote cardiovascular health for Black Americans, we must first concentrate on awareness, screening, and preventative interventions. These are key to preventing cardiovascular disease in African Americans. This can be achieved by community-based interventions such as health fairs, workplace wellness programs, or community health agencies in the communities with a high African American population. With these screenings, patients can report and have blood pressure checks, cholesterol counts, and blood work to determine their risk for cardiovascular disease. Considering the high prevalence of elevated blood pressure in African Americans, if the high blood pressure is detected early, it can be managed before it causes too much damage. Since high blood pressure does not present with any outward symptoms, it can be difficult to detect. By being screened at one of these places, we can catch it early and treat it before it gets out of hand. Also, by promoting awareness, we can educate the Black community and other communities about these issues so they can be more informed when making health decisions. Also, it is important to promote lifestyle changes. Smoking cessation is a must. By quitting smoking, it lowers the chances of high blood pressure and arterial and venous damage. Also, promoting increased physical activity can help lower risk of cardiovascular disease. And lastly, promoting a healthy diet can help reduce cholesterol levels and promote a more healthy blood pressure, reducing risk of stroke and heart attack in African Americans. This concludes the presentation. Thank you for listening, and please click the link below to take the post test.